Okay, good evening once again, ladies and gentlemen. My name is Hfea Laws and I'm your host for this evening's webinar. So we're going to have a couple of presentations on surrogacy, both in the UK and abroad. So first and foremost, I'd like to introduce our panel for this evening's presentations. We have Dr. Venkat, who's the director at Harley Street Fertility Clinic, and Ms. Hilary Smith, who is the International Client Relations Manager at Extraordinary Conceptions. And I am your host. So the presentations will cover the process involved in surrogacy and the particulars of surrogacy in the UK, which will be covered by Dr. Venkat. And then we will take a look at surrogacy in the US and the hybrid program that we have in place here at the clinic. The event will be, sorry, I forgot to say, the second half will be presented by Hilary. The event will be recorded and uploaded on our website for you to view in future if you want to come back, if you missed something. We will have a question and answer session at the end. Please submit your questions via the Q&A function on Zoom, or raise your hand and we will come to your questions in turn. If you want to stay anonymous, that's no problem at all. You don't have to say your name and your camera can remain off. So without further ado, I would like to hand over to Dr. Venkat. Thank you.
Thank you very much, Sudhir. Good evening, ladies and gentlemen. Welcome to our webinar. Surrogacy is now a common topic, and it's more popular in UK nowadays with new indications, as you can see. Originally, surrogacy was introduced for women who could not carry the baby. For example, a woman who's born without uterus, and that you might have heard called Rokitansky syndrome. They need somebody else to help them to carry the baby. And people who have damaged uterus due to various treatments and other issues, or people who have immune issues and repeated recurrent miscarriages in spite of having good embryos. These were the reasons where when we were using surrogacy, when I started practicing in IVF, that was something like 20, 25 years ago. However, now things have changed. We have surrogacy treatment commonly used for alternative families like two dads, as you can see, single women, and also for survival of the cancer patient, improved survival of the cancer patients. Next slide, please. Now, the scenario can be very different here. It's actually, as you all know, this involves three people, or it's called three-party reproduction. Therefore, here we have different scenarios. The person who carries the baby is the surrogate, and the pair of intended parents. Okay, that can be, like is pointed out in the picture, two men, or a single man, or a man and woman, or single woman. This can be anything. So in this case of two men, of course, obviously they need an egg donor to provide the egg, and one of them will use the sperm and fertilize the eggs, and the surrogate will carry the baby. And in the single case of single man, of course, he will use the sperm, and we need an egg donor to provide the gametes, and then surrogate will carry the baby. And here in heterosexual, sorry, I was not careful enough to switch on the video. Sorry about that. Now you can see me. So in the case of heterosexual couples, sometimes the intended mother uses her eggs, sometimes they use donor eggs. And here, single woman, she can use her eggs and use a sperm donor. These are the different scenarios. And finally, the surrogate will carry the baby under these circumstances. Now, when there is another scenario where surrogate eggs can be used as well, and that is called genetic surrogacy. and the other one where other people's eggs are used, it is called gestational surrogacy or host surrogacy. That is, here the woman does not use her eggs, she only carries the baby, or these intended parents rent her uterus to carry their baby. That is the way we should put it. Whereas if she also gives her eggs, that is called genetic surrogacy. That is, she uses her eggs as well as the intended parents use her uterus to make the baby first and carry the baby. This can lead to some issues. In some cases, it has had the problems because the mother can find it difficult to hand over the baby at the end because she's got that genetic link to the baby. That is why nowadays many people don't use this method of surrogacy, but we can discuss it at a later stage. So could I have the next slide, please? Okay, now what are the pathways? That is step by step, the treatment, how it is started and how things are done, in which order things are done, that is the treatment pathway. First of all, I will say the gamete provider, that is the donor or the intended mother and father, they need to have fertility assessment. We need to know how good the sperm is, how good the eggs are, how many eggs the mother has got or the donor has got. Of course, donors have strict criteria for selection, which is regulated by the Human Fertilization and Embryology Authority, who give conditions or stipulations for selecting the donors. So we follow their guidelines in recruiting the donors. Intended parents, of course, they need the assessment, or the woman who is using her eggs, she needs the assessment. That can take, initially it is assessment of fertility, then they undergo screening tests and also the blood test to check their infections as well as the genetic material, that is karyotyping and genetic, any other genetic issues involved in their cases. The next one is to, once we have assessed them, screen them to make sure everything is okay. In case there is some issue, we discuss with them beforehand so that they understand the implications. What does it mean by that? So according to the ovarian reserve and fertility status, we can give them information about their chances of success. If it is an egg donor, obviously the success rate is one of the best, with the success rate of 50 to 60%, because all the donors are young, under 35, and usually they have had children or made somebody pregnant with their eggs, and they are healthy, they're screened for all diseases, the success rate is the best. Whereas if it is own eggs, it depends on the age of the woman and the number of eggs and quality of the eggs, and similarly the age of the man, the quality of the sperm and other parameters of the sperm. And depending on these factors, we are able to give them information about their success rate. Next, what happens is to create the embryos. We always advise our patients, intended parents, to do their test and get everything organized and also create the embryos, because it takes time to recruit the surrogate. And in addition, the surrogates are interested in proceeding with the treatment straight away. Therefore, if the embryo is created first, they would opt to choose this in such intended parents. And it's a good idea to create the embryos. So the intended mother will go through ovarian stimulation, or of course, when we use the donor would have done that. And during the stimulation, they are monitored carefully to adjust the dose of the hormones. Then they undergo egg collection procedure, and the eggs which are retrieved are fertilized using the sperm, and they become what are called embryos. The embryos are cultured into blastocyst stage. And in some cases, if the couple wants to have the testing of the embryos, we perform pre-implantation genetic assessment, that is checking if the embryos are chromosomally normal or abnormal. In this case, we can select the best embryo, chromosomally normal embryo, for transfer into the surrogate. This will again reduce the risk of miscarriage in the surrogate and increases the chance of having a healthy baby. And some people choose to do it to reduce the interval between the treatment and the pregnancy or the live birth. Once the embryos are created, with testing or without testing, they are frozen. And then the couple start looking for the surrogate. They do their screening, go through the agency and find the surrogate and perform then preparation of the surrogate. So again, initially the surrogate needs to come for consultation, all the screening tests to see if her uterus is good enough to carry the baby. And we check with saline scan to see if there is anything interfering with the regularity of the uterine cavity, in which case we need to do some minor procedures to correct it. And then we prepare and start the treatment for the surrogate. Now, assessment of the surrogate and including the fertility assessment, it can take some time because first of all, finding the surrogate, it takes a long time. And then assessment, all the parties involved in surrogacy are required to have counseling. That is because everybody should understand the full implications. They should all be on the same page, because if people have different expectation, it leads to complications in surrogacy treatment. Right now, I can say that things are very much streamlined with all these organizations helping the couples, that is parties on both sides. But in initial stages of my career, I have seen some surrogacy treatment becoming complicated and leading to issues. Therefore, nowadays, with proper arrangement and proper counseling, people understand what their role is and things go smoothly without any issue. Could I have the next slide, please, Suvir? Okay, now choosing an egg donor. So you have to, there are two issues here. One is choosing an egg donor, and the other one is choosing a surrogate. So egg donor is important. This is a young lady who came to our clinic to donate her eggs, and she donated a couple of times and made people very happy because they had a baby from her eggs. And we always tell her, look, you changed these two women's or couples' lives so much. And she had tears in her eyes, at that time, because we think donor is just giving the eggs. She is not involved in that. No, when we tell them so-and-so is pregnant, not so-and-so, we can't mention the name. Some patient is pregnant from your eggs. They feel so emotional about the whole issue because they do it for a good reason. So in the egg donors, what is very important, people always look for blue eyes and blonde hair. I want a 6-foot donor. Everybody, you may not believe this. One of our recipients rejected a donor because she was 1 inch shorter in height. She wanted something like 5'8" or 5'9", and then the donor we offered was 5'7", 5'6". Therefore, she said, I don't want this donor. Please, I will wait till I find a donor who is 5'8". I always felt that, look, yes, 1 inch shorter is not going a big deal. However, you must get a baby out of her. The important thing is proven fertility under these circumstances. You must make sure the donor has had a baby before, or if they have used her eggs in treatment before, whether those people got pregnant or not. And so these are the aims. See, successful treatment and a healthy baby are more important than blue eyes and blonde hair. But of course, that is also important. I'm not saying that you must forget about it. But if you have shortlisted some donors, if you have somebody who has got a proven fertility rather than the characteristics you love, you should choose that one because you are more likely to end up with a baby with her eggs rather than another donor who's new, because then you are taking a chance. Okay, so as you all know about it, the donor should be less than 35 years and BMI 20 to 30. This is something we are finding it difficult these days because we are seeing more and more, high BMI patients, and also the donors are also now high BMI. We have rejected so many donors based on their BMI, and no significant medical history of any illnesses, even mental illness, psychiatric illness. You might be wondering how we check all these things. We send a letter to the GP asking for specific details regarding inherited diseases, mental illnesses, psychiatric illness in the donor or in her family. Only when he writes and we know that she's clear of all these things, we accept the person as a donor. And the donor should have, another important thing is good ovarian reserve, because in some cases we are using because the person doesn't have good eggs or good number of eggs. Therefore, if the donor doesn't have good ovarian reserve, the treatment is not going to work. That is one of the criteria. And of course, they are screened for infectious diseases. And if they have had a child previously, that is even better because they are obviously fertile donors. So we'll next slide, please. Now, next step is to surrogate, choosing a surrogate. How will you select a surrogate? Here, the points are totally different. So she should have a compatible lifestyle for a healthy baby. So we say, you don't want somebody who is a chain smoker to be your surrogate. So that is something very important. And not drinking too much, not using other drugs and other things. So she should have a healthy lifestyle and optimum BMI. That is not overweight if you can avoid it. Okay. And other thing is her personality. That is, you should be able to get along with that person. If you think that there is a personality clash, this relationship or arrangement is not going to work at all. So you have to be careful. That's why we say, yeah, both the parties should be on the same wavelength. And other important thing here is certain decisions will have to be made during pregnancy, and both the parties should agree. Say, for example, if the baby has got some disability like Down syndrome, what are we going to do? Say the intended parents want the pregnancy to be terminated, unfortunately, or, because that is the plan from the beginning. And in which case the surrogate should agree to that. She should not say that, no, I'm a Catholic, I will not undergo termination, because that can lead to problem. She will keep the baby. Who will take the baby at the end? Therefore, from the beginning, these points should be discussed, such as termination owing to genetic conditions. And supposing she needs cesarean section, at the end, she should not come and say that, oh no, I won't have cesarean, I will only agree for normal delivery. These kind of things should be discussed. And similarly, 1 or 2 embryos. In surrogacy, if we use an egg donor, we generally transfer 1 embryo because that is the optimum number we would like, or we aim for 1 healthy baby these days. And especially we are transferring blastocyst that has a high implantation rate of 60%. And if we test the embryos, that is especially if we know that this embryo is chromosomally normal, the implantation rate of such embryo is even 70%. In which case nowadays, we don't tend to transfer 2 embryos. But in some exceptional cases, if the couple or the surrogate has had treatments, unsuccessful attempts before, or if the embryo quality is not so good, then we might recommend 2 embryos. Again, there should be some agreement between the intended parents and the surrogate, because they should agree for the same, aim for the same thing. And if we say 2 embryos, the surrogate should be willing to have 2 embryos and be ready to carry twin pregnancy, because you never know. There are some patients who end up with twins, and if she is willing to carry twins, then only we should transfer 2 embryos. And we should discuss all the possible scenarios like this. We'll say, for example, we should have a birth plan. Who is going to be the birth partner? Who will all be in the room? All these things, every little detail should be discussed, because when things start happening, everybody is under stress and nobody can think straight. Therefore, it's better to have discussed all the scenario beforehand, have a plan, and which should be agreeable for both the parties, feel comfortable for both of them. Therefore, we should have a plan, and also in writing, it's always better, because sometimes we don't remember what we say. Oh, I thought it was like this, or I said like that. Especially it's 9 months since we started the journey. Therefore, it's better to have it in writing. And all these arrangements will reduce the risk. That is the idea, because the complications and risks happen because we haven't thought about it beforehand, or planned for it, or discussed about it. Now that it's all done properly through the agency, these arrangements go very smoothly. So can I have the next slide, please? Right. Requirements to be a surrogate, like the egg donor, there are certain things. Aged usually, ideally, between 25 and 45. And I said normal BMI, not too high. And preferably, they should have had a child. And in fact, we used to say preferably completed her family, because sometimes during pregnancy, complications can occur. One of the unpredictable or severe complication is hemorrhage during delivery. And due to hemorrhage, sometimes people end up with hysterectomy, very rarely though, but it has happened. And if it happens in such a case, and they will sort of find it very difficult. Therefore, it is better that they have completed the family. But nowadays we say at least they have had one child, then we can accept such a person as surrogate. And they should not have any significant medical history or cardiac problem and other issues which will make it difficult for her to undergo the pregnancy, or in other words, no contraindications to the pregnancy. And we should also take into account the welfare of the child, because she is carrying the baby, she is growing the baby for the first 9 months. So we don't want somebody who is not going to take care of her health. Then only the baby will be healthy. And it's not mentioned here, of course, we don't want smokers and heavy drinkers, which is not good for the baby. So these are all, of course, people now, everybody knows it, but I thought it was important to mention it. Can I have the next slide, please, Will? Now, this is an important point in the surrogacy treatment counseling. Like I mentioned before, counseling is not to assess the psychological condition of the surrogate or the intended parents. It is not. It is called implication counseling. It is not supportive counseling or other way of assessment counseling. It is implication that, do the intended parents understand what their role is and how they have to support the surrogate? Do they understand all those things, and what do they expect from the surrogate? And similarly, they must tell the surrogate what is expected of her, what are the implications for her, and what can she expect from the intended parents. All these things are discussed now, and the counselors these days advise the couples to have a written agreement signed in front of the solicitor, so that later on, if there is some disagreement, they can refer to this agreement and get back on track. Having said all these things, these agreements are not at all enforceable in the court. If something goes wrong, there is a problem. We can't say that she didn't follow it. We can't take her to court because this is not enforceable. But this at least makes people realize that this is a serious matter. They should think about it carefully, understand what they are getting themselves into. And that's why we put it in writing, so that everybody understands. And if it is in writing, people always think seriously about it. If it's saying it casually, people say anything. Whereas if you put it in writing, they are carefully writing and saying things. So that's why counseling, now they will also address any concerns, resentment or fear in the couples or in the surrogate, expectations and arrangement. Other important point we have to discuss in detail between the parties is how she's going to hand over the baby. Because some surrogates will say, I don't even want to see the baby, because if I see the baby, I'll start getting attached to the baby. But some surrogates want to see the baby and then hand over. And who will take the baby, when, at what stage they will do all these things, that will all be discussed. And in case of some unpleasant scenarios, then how to deal with it. Such details will be discussed. And it's like I mentioned before, the surrogacy arrangement, it depends mainly on trust, works mainly on trust, not legal mandate, because there is no legal contract here. Because the surrogate does this for altruistic reason. She's not doing it for financial gain. Basically, I have seen so many surrogates, and they are amazing people, I have to say. Look, they come and they are willing to help somebody they have not met before in their lives and carry the baby for 9 months. And during pregnancy, they have hormones, morning sickness in the first 3 months. And then towards the end, they can have complications like high blood pressure, diabetes. They are willing to put up with all these things to help someone. So I always feel we have to adore these amazing people who come forward to help such couples. And these people, the arrangement usually is based on the trust. Next slide, please, Suvir. Now, surrogacy laws are different in different countries. So if somebody is going to have treatment in the UK, we should be aware of these laws in this country. And if somebody is going to have surrogacy in the USA, the laws are totally different there. So one should be aware of that. That is where our international agencies come handy, because they are able to guide you about different arrangements. And in some countries, it is easy to find surrogates so that you will be able to achieve your goals at a shorter interval. Whereas in the UK, it's becoming more and more difficult to find a surrogate these days. Okay, now in the UK, surrogate is the legal mother. That is, the birth mother is the legal mother in this country. Whether it is her eggs or somebody else's eggs, it does not matter. She will be the legal mother, and then the intended parents have to adopt the child later on, that the solicitors will go through the process with you. And another issue here we must remember, if the surrogate is married and she's got a husband, her spouse is the other parent, second parent. That is automatic. We cannot change it. So birth certificate will have the surrogate's name as well as her husband's name in the birth certificate, or the spouse's name. But if she is not married, only her name will go on the birth certificate, and one of the intended parents' name can go on the birth certificate as second parent. Okay, that is possible, but this is not possible in the case of the surrogate being married. So these are all important differences we must remember. That's why when we take history, we take detailed history. Are they with the partner, separated, divorced, legally married or not? Because different things have different implications. And the clinics have different consent forms to be signed as well for all these purposes. So that is very important. And so then court order for surrogacy reassigns the legal parenthood. That's what I said. Then intended parents can put their name in the birth certificate by this, and makes the intended parents legal parents and ends the surrogate's responsibilities. So that is how it is done. As soon as the baby is born in the UK, surrogate's name and her husband's name will be in the birth certificate. And then later on, the intended parents first will apply for parental order, or later on, then they go for adoption based from the parental order. That is all through the court procedures. This solicitors, they will explain in detail about these processes to you, at what stage it is to be done, because certain things from 6 weeks to 6 months, what some other things are after 6 months. So they will go through in stages for you to complete the process. Because I remember some 15 years ago, we did a surrogacy treatment. This lady came from overseas. And the surrogate was in the UK, and they are sisters actually. She came from Italy, and she didn't check the law at that time. Like I said, those days the agencies were not very common. There was only one agency for surrogacy, that was the courts, and the second agency, the Surrogacy UK, was set up after this case. And that time they didn't do proper research, and this lady is still not able to get her name on the birth certificate due to some complication about her ethnic origin and her nationality and everything. That was a complicated case. That is why it is better to know from the beginning the law of the country. And if you are going to have the surrogate delivering in the USA, the laws are totally different. Therefore, please be aware of the local rules so that you can plan accordingly. Suvir, could I have the next slide, please? Right. So when we said the selection for the surrogate, there are also restrictions. Because, for example, if the clinics can advertise for egg donors and find egg donors, but somehow the regulator, that is the Human Fertilization and Embryology Authority, have got a restriction saying the clinics cannot advertise for a surrogate. That is, I mean, there is a discrepancy here. Why you can spend money and advertise for an egg donor, but not for a surrogate? Sometimes it is difficult to explain all these things. There may be good reasons for this, but the clinics cannot do that. And similarly, they said that we can't match a surrogate for profit. That is, somebody wants money and that's why she's become a surrogate. We can't do that. And surrogacy arrangement, as I said, there is no legal basis for this. And lawyers are not allowed to negotiate their terms and conditions between the surrogates and intended parents. The legal process comes into play only after the delivery, how the intended parents can become the legal parents, that's all. But now before that, we cannot enforce anything on the surrogate or intended parents. It is difficult. And that is why it's important you select the right surrogate with whom you can get along without any problem. If there is a sort of clash in the personality, you can say from the beginning it's not going to work, because both parties should be able to get along well with each other. And how much can you pay a surrogate? It's assessed by court in retrospect, and usually the typical amount is from 15 to 20,000 pounds. That is commonly seen these days. Subir, could I have the next slide, please? Right. Options for surrogacy. Surrogacy, you can use your family members and friends as surrogate, because that is the best option. The motive behind this is slightly different, because supposing your sister is going to carry the baby, yes, sister will help you because you are both sisters and she wants to help you. Whereas a third party, an unknown person, of course, you get to know the surrogate, they will do it, but there is that family bond is not there. That is why this is a little bit stronger and also probably not that expensive and easy to get along with your family. That is why in most of the families it's like that, but sometimes things can go wrong. So that is one of the arrangements. An independent surrogate, and that is, nowadays there are a lot of organizations like Facebook, and they have separate page for surrogacy, and other agents also like Pride Angels and private organizations. And there are these non-profit organizations which have been there for ages, like COTS and Surrogacy UK. Actually, the Surrogacy UK was started by a woman who was a surrogate 3 times. She had treatment under my care when she was a surrogate for 3 intended parents. She had the treatment in our clinic, and I looked after her. I know her very well. And she at that time set up that Surrogacy UK because courts were very busy. They had long waiting lists. That's why she wanted to set this company or organization to help the parents, intended parents. And now we know popular UK agencies, Brilliant Beginnings. Our clinic works very well with them. Whenever we have some inquiries for surrogacy, we send them to this organization. And similarly, we work with international agencies. Extraordinary Conception, as the name suggests, they are extremely very, very helpful people, and they know the rules in both the countries, and they do organize and streamline everything for us. And recently we had a surrogate from USA came to UK, and she had the embryo transferred last week, and we are keeping our fingers crossed for her to be successful. And the intended parents are not in the UK, they are in one of the countries in Europe. So this is really an international arrangement. Nowadays, you don't have to feel shy or hesitant to go overseas, because that helps you to achieve your goal in a shorter time. And the Extraordinary Conceptions are very helpful and friendly people who will take you through your journey. And similarly, there are other companies also. We have some of them in our list, but we work mainly with Extraordinary Conception, who bring surrogates from USA mainly. And of course, intended parents come from different places, and including UK. Next slide, please. Okay, now you might think that, look, for egg donation, we don't go through an agency mainly. You come to the clinic, we have an egg donor, and we offer you the donor, you have treatment. Why is this? Then you ask us to see an agency for surrogacy arrangement. I think this is, as I told you, it is a complex treatment, not simple like egg donation. You give the egg and the recipient gets the egg and goes and has the treatment, whereas it is 3 people are involved. And also the treatment is not like egg donors come and donate the eggs, the treatment is finished. But surrogacy goes on for 9 months. And all the time she's carrying your baby. You are interested in the welfare of the baby. So we want things to go all right for 9 months, from even before the treatment and everything, and whole delivery. And even after delivery, the process has to be completed. So it is a complex treatment, and you will need support at different stages. And in case of problem, they are there, or they are there to guide you from the beginning. I think that is why it's useful to seek the help of an agency. And they will also help you to choose a surrogate. They will offer you some surrogates, and then you meet with the different surrogates. And then if you are not sure, you can talk to them. They will help you to choose a surrogate. And usually the solicitors are attached to these agencies, so you can seek legal advice, and they normally help you to write the contract between the surrogate and the intended parents. All these things, like to help to reduce the risk, because we don't want anything to go wrong and for the intended parents to regret or surrogate to regret. Therefore, it's important you involve a third party to help the parties involved from, because it's not only medical, clinical, it's emotional and also legal. So many aspects are involved. Therefore, it's better that you have an independent organization supporting you and all those involved in the treatment. Next slide, please. Okay, so the agreement, like I mentioned, it's not legally binding, and that's why we must discuss all the issues, things which could go wrong. I'm not going to discuss if everything is going smoothly, then there is nothing to discuss. Only when there could be difference of opinion, difference of views, and things can go wrong, then we must discuss all those things. And this is why we say the counseling is mandatory in the UK agencies, because the counselors go through all these steps with you. And like I put it earlier on, I mentioned it to you, it's always good to put all these points which you discussed and agreed in writing, because then I know we can't take anyone to court. It's not enforceable in court. However, it makes the matter a little more serious, and people also take it seriously. Better to put it in writing. At least you can remind them. When things go wrong, you can say, this is what is written, then people will understand. The next slide, please, Suvin. All it remains for me to say now is thank you. And thank you for my colleagues for helping me and helping with this surrogacy treatment, which takes a lot of time. And now I'm going to hand over to our partner, the Extraordinary Conceptions. Thank you very much.
Hi, everyone. Thanks, Dr. Venkat. Thanks for coming today. My name is Hilary Smith, and as Suvir mentioned, I'm the International Client Relations Consultant for Extraordinary Conceptions Agency located in California, USA. So some of the topics that I'm going to touch on tonight are just getting started in the surrogacy process, and then just a little bit about the surrogacy process and the steps that you should expect to take. A little bit about the criteria for surrogates, regulations in the United States. I'll do a little brief overview of the cost and what to expect and what to budget for. I'll answer a couple of frequently asked questions we often get from intended parents, and then I'll touch on a little bit about our agency. Next slide, please. So getting started is where I will begin. The three main providers that I often tell intended parents about on our initial call that they should always consider when going through the process in North America is your agency, your clinic, and your attorney. So your clinic, of course, is there for all medical aspects. They're there for the embryo transfer, to create your embryos, for medications, for orders, and your attorney is there for all legal matters. So that's your attorney over here in the UK, but also your attorney that will be drawing up the contracts for you and your surrogate in the US. So we as the agency are there as the support for all parties. So for both you and your surrogate and your egg donor, if applicable. We're there to help you find your fertility team. We're there to work directly with your IVF clinic to coordinate your surrogate's entire cycle, help them get set up locally for screening, monitoring, help them with their travel. We are basically there to help everyone from start to finish. We're also there to be your advocate through the process and your main point of contact from prior to matching with your surrogate all the way until post-birth. And then we're there to continue to support your surrogate even after she's given birth and you've gone back home with your baby. So when it comes to the surrogacy process, the first step is the matching process, and that is the main job of the agency. So with every agency does things slightly different, but with our agency, we always have intended parents register first, just so we can get some basic information about you, what you're looking for, what your needs are. We'll set up an initial consultation with you to go over the process in detail, to go over the options, to answer all the questions you may have. We'll also have you fill out an intended parent profile. So this is information that you'd like to share with a potential surrogate candidate that you're interested in. So it's very similar to the surrogate profiles that you would review, but it's just information on yourselves so that your surrogate can also learn a little bit about the intended parents. At the end of the day, you will be reviewing surrogate profiles, but it is a mutual decision about moving forward together. You'll start to review surrogate profiles with us. We will share you profiles of available surrogates we have across the US. You can also go onto our database for free and full access once registered to look at profiles, read about them, ask us questions. Once we've narrowed down your search a little bit, we will have all of your surrogates' medical records sent to your IVF clinic to review and pre-approve, medically speaking, for the match. So they'll review all of her obstetrical history records. If she's done any surrogacies previously, all of those records as well, just to make sure that they give the thumbs up for the match. Then we will move forward to introducing you to your surrogate over a guided Zoom or Skype call. On that call, you'll get to know each other. We'll go over some important questions, things like termination, make sure everybody's on the same page on those important topics, and also to make sure, you're just on the same page in general with communication through the process and that sort of thing. And once the match is confirmed, then the screening process is initiated. And we will send all the match details to your IVF clinic. And we are very much guided on the medical side by the IVF clinics that we work with. So for example, working with Harley Street, we will send all of the surrogates' medical records to the clinic, and they will send us orders for screening, and we will help your surrogate carry out screening locally. So in the hybrid program, where we work with US surrogates and intended parents that have embryos in the United Kingdom, all of the screening tests will be done locally in the US and we follow the orders that are given to us from the IVF clinic. We help your surrogate go to a local clinic, IVF clinic, get all of the screening completed and send the results to your IVF clinic in the UK to review and make sure all their screening is completed. Once she's been medically cleared by your IVF clinic, then we will initiate the legal contracts. Both you and your surrogate will have separate attorneys. We will set your surrogate up with an attorney. We can also set you up with an attorney if you don't already have one in the United States. And contracts are enforceable in the United States and are a mandatory component of the process and are required to be finalized prior to your surrogate starting any medications in preparation for the embryo transfer. Once legal contracts are finalized, your surrogate can then start her medication protocol as per the IVF clinic's instructions. Then we will help your surrogate plan her travel to the United Kingdom for her embryo transfer. She will have her embryo transfer and then head back to the United States to hopefully continue the pregnancy, all going well, and then deliver in the United States. And by that time, you will need to travel to the United States and that's the only time you actually have to come to the United States is obviously to attend your child's birth and to pick up your baby to bring them back home. Next slide, please. So the whole process, a lot of people ask us, how long does the whole process take after match? So from match to the embryo transfer, you're looking at between about 12 to 16 weeks. It could be a little bit less or a little bit more, depending on the situation, the clinic, the location of the surrogate. But during that time is when the screening of the surrogate happens, the psychological assessments for both your surrogate, yourselves, and for the surrogate spouse, if applicable. The legal contracts happen, and then the preparation for the embryo transfer. And then if you tack on the pregnancy for 9 to 10 months, then you're looking at about a year or more from start to finish. So the criteria for surrogates in the USA is quite strict. And surrogates do have to go through a very rigorous vetting and screening process and have to meet very specific criteria in order to become a surrogate. So with our agency, the initial application is filled out through our medical records and admissions team, and they have to provide us with their full medical history, their personal situation, their obstetrical history. We will collect from their OB or midwife. We have to go over their personal situation, their marital status, their family medical history. We are very, very thorough in terms of the application process. And although there are many, many, many amazing women that want to be surrogates and apply to be surrogates with us every single day, not all of these amazing women will end up onto our database to be available for surrogacy. And that's because there are very specific criteria that surrogates need to meet in order to even become a surrogate. So in the next slide, I've just listed some of the basic criteria for surrogacy set out in the United States and in most countries as well. But these are the Asrm Guidelines, which is sort of the guidelines that in the United States are followed very strictly in terms of who can meet those basic requirements for surrogacy or not. So some of those criteria are a BMI below 30 is ideal, up to 32 or even up to 35 in some cases, as long as the woman is healthy otherwise. Between the ages of 21 to 39 is ideal, some cases up to 42, and in Canada and the UK, sometimes up to 45. Healthy with regular menstrual cycles, she must be alcohol, drug, and tobacco free. Of course, she must be a parent of her, so have had her own successful complication-free pregnancy carried to full term at least once. She must not be receiving any government assistance. She must be financially stable. Therefore, she can't be relying on the surrogacy to put a roof over her head or feed her family. She must be a North American citizen or have a permanent residency in either US, Canada, or Mexico, so somewhere in North America. So no prior felonies, and the same will go for the spouse if applicable. Criminal background checks are done on both the spouse and the surrogate. Surrogates can't be on certain medications for anxiety or depression, and she must be without a history of mental health disorders. These are just a few of the basic criteria for surrogacy. So when it comes to the regulations in the United States, next slide, please. The United States is run by state law. So that means that each state has its own rules and regulations when it comes to surrogacy, and every state is completely different. So the laws do vary widely across the United States. Most states, I would say, are surrogate friendly. So allow surrogacy, but the rules and regulations are just slightly different from state to state. In the United States, though, in the surrogate-friendly states, contracts between the surrogate and the intended parents are enforceable, and they are mandatory, and they are put into place prior to an embryo transfer even happening. So that's a little bit different than when you're going through the UK surrogacy process, where contracts are not enforceable. In the United States, in most of the states, compensated surrogacy is legal. Altruistic surrogacy is legal in some of the states, and surrogacy is not legal in a couple of states, but most of the states, compensated surrogacy is legal. It is very important to consider what state to pursue surrogacy in, and that's part of the reason why your agency is there to support you and help you find a surrogate in a state that is where you will be able to be the legal parents on the birth certificate in, and your agency can help you find a state that suits your needs and for your specific situation. So when it comes to legal parentage and surrogacy in the USA, although the legal processes do vary from state to state, as I mentioned, in the USA, you will be, the intended parents will be the legal parents on the baby's birth certificate, and the surrogate has no legal rights to the baby in all surrogate-friendly states. So where surrogacy is legal, the contracts are also enforceable, as I mentioned, and those are put into place before an embryo transfer even happens. And then there's the pre-birth order, which determines legal parentage before the child is even born, and that is put into place around the 3rd trimester of pregnancy. So that way the surrogate's name is not on the birth certificate at birth, the intended parents are. With that being said, in a hybrid program where the surrogate is located in the United States and the clinic where she'll be undergoing her embryo transfer is in the United Kingdom, she will be giving birth in the United States, but you will be going back home with your baby to the United Kingdom. And just because you are the legal parents in the United States, in the US, when you go back to the UK, it doesn't automatically transcribe over. You do still need to go through a legal process when you return home to the UK. And that is why we always recommend intended parents also have legal counsel in the United Kingdom and speak very early on to the UK-based attorneys so that you know what to expect when you bring your baby back home and the legal process you need to go through in order to assume legal rights in the UK as well. And we as the agency can introduce you to some amazing surrogacy attorneys across the UK for that aspect of the process. So now I'll just go over a little bit of the cost and what intended parents should expect to budget for when going through the US surrogacy process. So we did talk a little bit about the 3 main providers that of course you need to budget for, but there are some other things that intended parents might not think about when they start the process. So obviously the agency fees that will include the surrogate compensations or reimbursements, the clinic fees that will be for all the medical, the creating of the embryos, the embryo transfer, medications, but there's also things like outside monitoring. So if that's applicable, so in a hybrid surrogacy case where the surrogate is in the US and the clinic is in the UK, she will not be going to the UK for her screening. Her screening will be done locally, and that will cost the intended parents additional funding, which is all held in the trust account and handled through our agency. But that is an additional cost that intended parents need to think about. Also the travel costs for your surrogate to fly for her embryo transfer from the US to the United Kingdom. Also the travel costs for the intended parents when they need to go for the birth of your baby. You need to think about those costs as well. These are some of the things that intended parents might not think about early on, but they are costs that they should incorporate in their overall budget. And then of course the legal fees on both the US side and on the UK side. So the contracts, so you will in the US, you will need a lawyer, and so will your surrogate. You will be responsible for your surrogate's attorney costs and your attorney costs to create the contracts and for the pre-birth orders or post-birth orders, and then all the paperwork to get the passports and get you home with your baby, but also the legal costs in the UK. You have to go through your own legal process when you return back home from the US. And then the last thing would be the insurance. So in the US, there is not national health. Therefore, the surrogate does require maternal insurance to cover her entire pregnancy, labor, and delivery. So that is an additional expense to think about. Our agency does incorporate that into our overall cost. But if some agencies might not, it is an additional expense, and it does make up quite a large portion of the overall budget. And then the last thing would be the newborn insurance, so which is completely separate from your surrogate's maternal insurance. And that is also something to consider in your overall budget. And when we have initial consultations with our intended parents, we always touch on, an estimated cost for each of these things so that the intended parents have a better idea of what the overall cost will be. So intended parents often ask us of the overall budget, how much of that is the compensation? So how much do surrogates get paid in the United States? And compensation does vary greatly across the US, just like the laws. Surrogate compensation can start at around $35,000 up to $60,000 US dollars or more, depending on the surrogate's employment status, where she's located, whether she's been a surrogate previously or if she's a first-time surrogate. So these factors all weigh into the amount of compensation that your surrogate will receive. So oftentimes repeat surrogates will request a higher compensation because they're proven, whereas first-time surrogates might start at a lower compensation. So it really just depends. Compensated surrogacy is not legal in all states, but it is legal in most states. And again, when you're looking at potential surrogate candidates, it's always a good idea to get a full breakdown of the costs, and our agency always does provide that. And we can let you know the compensation amount for any surrogates that you're interested in moving forward with. So we get a lot of questions asked regularly from intended parents. And a couple of those questions I'm just going to touch on that we get asked the most. And I would say this is the #1 question that we get asked. I probably get asked this question at least once a week from intended parents. And the question is, will the surrogate change her mind after the birth? And I know this is a lot of intended parents' biggest fear, but the short answer is, in North America, no, the surrogate has no intention of keeping your child. It is extremely rare, and in the 10+ years I've been in this field, I've never seen a surrogate change their mind and want to keep the baby. Most surrogates describe the process as a really long babysitting job, and are very, very happy to give the baby back to their parents once the baby is born. Surrogates are well aware of the expectations for surrogacy. The baby is also not genetically related to the child in a gestational surrogacy agreement, and those are the only surrogacies that our agency looks after. Most surrogates have completed their families already before getting into the surrogacy process. They loved being pregnant and they just want to help another family have a child, and this is their way to be pregnant again without having to have another child themselves. But on top of all that, psychological screening is mandatory for all parties. Home and criminal background checks are also mandatory. Legal contracts, as I mentioned, are enforceable in the United States, and they relinquish all rights from the surrogate to the baby. So the baby they have no rights to the child. And then, of course, the birth orders, the pre-birth order, the post-birth order confirms that the surrogate has no legal rights. The intended parents will be on the birth certificate at the birth. So even if, in the rarest case, a surrogate changes her mind and wants to keep the baby, it is not possible for her, as she has no legal rights to the child. Another question we get asked is, how much contact will we have with our surrogate, or how much do we need to have? And I always let intended parents know that there is no specific amount of communication you must have with your surrogate. This is completely personal and up to you and your surrogate. Of course, we as the agency are going to support whatever amount of communication or whatever sort of relationship you'd like to have with your surrogate and your surrogate would like to have with you, as long as it's blooming and good, and communication is, fair on all sides, then we are happy to support any amount of communication. We do discuss communication expectations very, very early on in the process, just to avoid any potential conflicts down the road. We want to make sure that intended parents are being matched with surrogates that are on the same page. Because some intended parents might want updates on the pregnancy every single day, and some surrogates might be more comfortable, sending updates just at important milestones or once a week. So we just want to make sure those are things that we always discuss on the first initial meeting with the surrogate, just to make sure that the match is going to be good and everybody is sort of looking for the same thing going into this process. Next slide, thanks. So finally, I'm just going to talk a little bit about our agency, Extraordinary Conceptions. Extraordinary Conceptions is one of the largest international agencies out there. Actually, we opened our doors 16 years ago. Our CEO and his wife had their children through surrogacy actually over 20 years ago, and that is sort of how Extraordinary Conceptions came to be originally. They wanted to help other intended parents through this process with many moving parts, and it's quite complicated. So they wanted to help other intended parents through it in the easiest, best way possible, and it's just grown since then. We are headquartered in California, but we do have staff located in several countries around the world, such as myself, who is located in the UK. I assist many of the all of the UK-based intended parents and many of the European-based intended parents. We have staff located in Costa Rica, Mexico, Canada, Italy, Spain, France, and of course the US. We speak up to 12 languages, so there's usually always someone on staff that can speak the language of any intended parent that comes through. We offer surrogacy programs all across North America, and of course our hybrid program where the US surrogate would travel for her embryo transfer to the United Kingdom or Canada. We have one of the largest egg donor databases in the nation, with over 3,000 available egg donors of all ethnicities from across North America, and even some international donors as well. Our surrogates are located in all states where surrogacy is legally practiced, and we do not have a wait time for surrogates in any of our US programs. We have programs to assist intended parents financially. We have an on-site insurance specialist, a travel department to help with all of your surrogates' travel and donor travel. And of course, we have close ties with top-tier reproductive attorneys from across the US, Canada, and internationally. So of course, we will set intended parents up with their surrogate and their surrogates attorneys in the United States, but also if intended parents don't know of an attorney in their country. So here in the UK, we can also offer referrals or direct introductions to some amazing surrogacy attorneys here in the UK as well, which is really important. And then finally, how do we get started on the process? I know it's very overwhelming when you first initially start researching surrogacy and the different options. There's hundreds of options and so many different agencies, clinics, all that. So we would always obviously suggest that reaching out to an experienced agency such as ourselves to get you started on your journey, or an amazing clinic like Harley Street in the UK who can get you started on the medical side as well, get you creating those embryos before you start looking for a surrogate. And then once you've found your clinic and your agency, you're pretty much well on your way at that point to going through this process, and all the other pieces will fall together, and as the agency will help you get through all of those moving parts. Thank you for listening.
I'd like to thank both our speakers for those presentations. They were very informative, and I feel like I always learn something whenever we do these webinars, so thank you both. And I think at this point, I'd like to open it up for a Q&A session. If the audience has any questions, please do put it through the chat function. I have a couple of questions myself, actually. First is more of a medical question, or legal and medical question in the UK and in the US. I think it's a recent change that allows single parents to undergo surrogacy, especially single men, if I'm not wrong. Is that true both in the UK, Dr. Venkat, and then Hilary in the US?
Yes, it is. You are right. It was introduced last January, I think, because they had a consultation and the HFEA was considering that introduction. And finally it came into force effect, saying that, single men and single women can have surrogacy. Because previously, yes, it was not allowed. And now it is allowed because things changed with previously, unless you are married, you could not go for surrogacy, even heterosexual couples or same-sexual couples. In fact, previously the male same-sex couple were not allowed to be married in the UK. That was the reason all the gay couples were going to USA, and things changed, and then they had civil partnership and marriage and everything, and they could do surrogacy in the UK since then. That's why there are a lot of surrogacy cases in the UK. And slowly the regulator realized that it's not fair to discriminate single men and single women. And that was also introduced. So they can now have surrogacy arrangement with the surrogate.
And Hilary, is it the same in the US?
In the US, there's options for everybody, and that's been for many years. It's been very well regulated for singles, whether you're gay or you're straight or you're on your own or whatever the situation may be. There are options for you in the United States, and there have been for a while. So it's good to see that United Kingdom is getting there and taking steps towards opening it up for everybody. But yes, there are options definitely across the United States for everybody.
A point of clarification on that. If I'm not wrong, in the UK, is there still a requirement for at least one of the intended parents to have a genetic link to the child in a surrogacy case?
Oh, is that for me or for
Dr. Venkat, sorry, in the UK.
Yes, that is true. In the UK, there is. So if the woman does not have eggs and she has to use donor eggs, I don't know the recent regulation about that, but usually they say that yes, because when there are two partners, at least if they use the sperm or the heterosexual couple or the egg of one of the partners, they can do it. But now with single women, they should be able to use their gametes.
Hilary, is that the same in the US?
In the US, it can be donor-donor, and you could still, depending on the state, because every state is different, but many of the states, it can be donor-donor, and the intended parent or intended parents can still have legal parentage on the birth certificate.
Great. And then I guess as a sort of crude idiot's guide to both of you, what are some of the common sort of misconceptions that you see with patients who are first embarking on surrogacy treatment when they come for that first consultation? If I can open that to Dr. Venkat first, then Hilary.
Well, sometimes they think that they don't need to wait for some of this in a quarantine period, because in the UK there are HFEA laws, human fertilization embryology guidelines say that if the intended parents, if they are using their gametes, they are treated as gamete donors, and they have to have all the screenings for them. And they don't realize this when they come for consultation, they don't realize it. So it's a shock for them. And there is a funny regulation in the UK saying that if it is egg donor, previously we were allowed to use fresh eggs, because those days we were not able to freeze the eggs. So we could not freeze the eggs. So the surrogacy cases, if we are using donor eggs, we were allowed to use donor eggs fresh. However, the sperm needed to be quarantined for 6 months at that time previously. So there was some discrepancy there. People didn't understand, but we couldn't also explain it, but we had to follow the guidelines. So the man has to freeze the sperm for 6 months before using in treatment. And in those days, we didn't have the NAT testing also. There was no way we could make exceptions. And nowadays, of course, we have the NAT test to say that the whether the virus is present at present in the body or not. We could prove whether they are carrying the infection. Basically, the quarantine, let me explain a little bit. When we say the sperm or the egg had to be quarantined for 6 months, the idea was introduced by the regulator because if somebody is getting the infection recently, and it takes the latent period for it to appear in the blood is sometimes like 180 days. And therefore, the regulator advised or recommended that the sperm should be frozen. The man should be tested first. Sperm should be frozen for 6 months. At the end of 6 months or 180 days to be specific, the intended father should have the screening test, the normal HIV, hepatitis B, hepatitis C, syphilis, etc. And if it is all clear, then his sperm could be released for treatment. This is to protect the surrogates because they didn't want any infection to the surrogate in case of any infection in the intended father. However, they could not do the same with the eggs because eggs could not be frozen those days. We were only using fresh eggs. So they allowed fresh eggs to be used and so this was a bit of a strange thing for the couples. Look, you are sort of asking one person to freeze for 6 months and wait for 6 months, whereas I can use my eggs straight away. That was the situation. We had to do that. And the another thing is cost. Sometimes the people come and say, oh, I want to go for surrogacy without realizing the cost, which is also huge shock or surprise for them. I think people should do some research if they don't want to go for surrogacy. It is not a cheap treatment. And like Hilary was mentioning, we just don't say the surrogate's cost is this much and the treatment is this much. There are other factors which you need to consider so that you are aware of the total cost. These are the things people should be aware of it. And in spite of all these things, the treatments are not always successful in the first attempt because people think that, okay, I'm using a surrogate, she has had a baby, she is a normal person, but still the success rate depends on the quality of the eggs and the quality of the sperm, age of the donor. And so it depends on who we are using. Is it a donor or is it the intended parents? How old is the intended mother? And what are her eggs like? So many factors are involved because when they are spending so much money and they expect that the treatment will be automatically successful in the first attempt, sometimes it doesn't happen like that. So people should be prepared for disappointment. And that's why it's better to have some frozen embryos, in which case you don't have to do all the process again. Instead, we can use the frozen embryos, which is cheaper and easier as well.
Hilary, what would you say are some of the common misconceptions you get, particularly in that first call?
Yeah, I mean, I think a lot of people are just talking about the hybrid program. I think a lot of people have no idea it's even an option and come to us to talk about, doing everything abroad, doing everything in North America. And when I mention the hybrid program as an option, they're surprised and equally very excited that that's even an option for them, because in their minds, surrogacy here is altruistic, in the United States, it's compensated, completely different rules and regulations, but I'm explaining to them that actually it's completely legal, and the surrogacy is actually a US surrogacy, just the medical aspects happening in the UK. I'm still following all the US guidelines. And people are really excited and surprised about that. And they think that, either they wait in the long waiting time for a surrogate in the UK, or they have to do everything in the US. And like you said, it's not a cheap process. There's no way to sugarcoat that at all. In the US, if you're doing everything there, yes, it is quite expensive. I mean, even if you're doing it in the UK, it's expensive, but the hybrid option is sort of a happy medium. And it is definitely a misconception that they need to go to one area or the other. They need to pick and choose, but actually the option to do both is there, which is great. That option is available to intended parents now.
Okay, great.
Can we say best of both worlds, Hilary?
Oh yeah, so being able to do their IVF close to home, getting their embryos created, being able to meet their doctor in person, not having to travel to leave their sperm or whatever it is. And then being able to be matched with a surrogate quickly and not having to wait in the UK system for years with a question mark at the end of when you're actually going to find the surrogate, or a surrogate's going to offer to carry your baby for you. So it's the best of both worlds in that way. Plus a little bit more cost effective to keep a lot of the process local, but still be matched with a surrogate. So it's an in-between cost-wise.
Yeah, can I ask you a question? Because you mentioned that when this UK, intended parents have surrogacy in the US, their name goes on the birth certificate in the US, but when they land in UK with the baby, of course, UK laws apply. But if they already have a birth certificate with their names, what do they have to do? I'm not so sure. That's why I'm asking this.
They still need to go through the same legal process as they would as if they had a baby in the UK with a UK surrogate. So they still, the legal system in the UK doesn't recognize, it still recognizes the surrogate as the intended mother, even if their names are on the birth certificate. That being said, the legal system here is very reassured how well regulated North American surrogacy is. It's very streamlined. A lot of people don't even use attorneys, although we do recommend using an attorney and getting advice from attorney at the very least about what that process is going to be like. But it is very streamlined coming back from a surrogacy in North America now. You still need to go through that waiting period of assuming parental rights here in the UK, and you still need to go through a court order process, but the names will be on the birth certificate. They will look at all that documentation and it will be transferred over. You just have to go through that waiting period and go through the process.
Okay, thank you very much.
No worries.
Okay, we have a question from an audience member. I think she wants to speak it, so let's see. Savita, you're muted at the moment. If you want to unmute yourself, you can ask.
Yeah. You can hear me now?
Yes.
Yeah, I'm really, happy to join the program today. And I have some question because my daughter, she's 17 now, and I was pregnant for 7 times. But unfortunately, that time I wasn't ready to keep the child. And nowadays, I feel I want to grow my family. And since I was trying normally since 2014, and I had again miscarriage. So I would like to go for the surrogacy or IVF. But what I learned from this today is really hard to get the surrogacy here. And if I go to the USA, and what will be the next step? And do you do IVF here as well?
Yeah.
Yeah. So sorry.
Go on, Subir, please explain.
Well, I think to answer your question, you can do any of the combinations that you wish to. So if you want to access medical treatment here in the UK, you can do that. And then you can choose a surrogate. You can choose to try and have a surrogate in the UK, but as both our presenters have alluded to, the waiting lists can sometimes be very long. And in fact, I don't know if agencies right now are even sort of enrolling new intended parents because their waiting lists are full. The alternative is to work with an agency such as Extraordinary Conceptions to seek out a surrogate further abroad, so potentially in the US or Canada or Mexico. And you can fly the surrogate over here for the embryo transfer. So that's what's called our hybrid program, where you do all the medical work locally, but then the surrogate gives birth in her home country, and you would go to that country to bring back the baby.
Okay. And you said I can bring the surrogate UK.
Yes, the agency will help arrange that.
Okay,
So
but in this case, what I learned from the doctor said all the what do you call the rule, it will goes to surrogate, or I'll be the legal parents, or the surrogate mother will be the legal parents.
So that's what we were just discussing actually with Dr. Venkat and Hilary. So what happens is, because the surrogate gives birth in her home country, the law of that with regards to who's the legal parent, of that child at birth. It's the law of that country or that state that applies. So in the US, it's done state by state. So the laws of that state would determine who the legal parents are at birth. So for example, I think if you're, let's say, to have a surrogate from California, I think if I'm not wrong, Hilary, the intended parents would be registered as the legal parents at birth.
Yes.
So you'll have a Californian birth certificate that says you and your partner, if you have one, are the legal parents of this child. But then what has to happen is, let's say you're resident in the UK, when you travel back with this baby, you have an American birth certificate.
Passport, yeah.
Yeah, no, you don't. I think you get an American birth certificate, right?
You also get an American passport. Your baby will have an American passport,
There you go.
but can apply for a British one once
So,
they're
and then to get the baby recognized here with a British passport and a British birth certificate, you can go through the legal process in the UK as well.
And you know, I'm really quite determined because I'm planning to visit in USA maybe end of the November or beginning of the December. So, you know, I really like to meet Hilary, if you could help me, because me and my husband, we are completely ready for surrogacy, and not here because I heard that, you know, who will be the mother of the child in surrogacy, and she will get the right. So I don't want this one. I want to be me and my husband to be legal parents of the child. So in this case, how do I meet Hilary, or how do I come to the clinic?
So I can arrange for our, I'll get your details later. I can arrange for our new patient coordinator to contact you, and similarly, I'll put you in touch with Hilary. The good news is you don't have to travel to the US to meet Hilary. She lives locally in the UK. So I'm sure she'll be happy to arrange a call with you to discuss all the steps that you should take next.
And
Yes.
another thing, you know, I was searching the online. I saw the price is quite high, you know, the USA one. So is there any chance then Hilary can give me the roughly idea? I know that, you know, the surrogacy, we need to pay more than 30 to 60,000, but this is the surrogacy. But another things is medication, the clinic, the agency. How much it will be the whole cost? Like, is my traveling, my husband traveling, everything?
So I think that's going to vary quite a lot based on some of the options that you might choose to go for. So it might be better that, you know, you and Hilary have an introductory discussion. You can lay out, you know, some of the criteria that you're looking for, and then she can give you an overall estimate of the costs you might expect.
Yeah.
I have been to this place, I think it's 2019 maybe, but that time we hasn't got, you know, that much money to get through. But nowadays, me and my husband, we are willing to go for this treatment, you know, surrogacy or IVF. So which one do you think, you know, we should go?
So I think it would be useful for all our parties to get a bit more information about you, and then give you the right advice as opposed
Okay.
to giving you sort of generic advice. It'd be good for us to get a bit more information about you, your history, you know, what the various factors involved in your previous failures of pregnancy are, and then we can sort of definitely guide you in the right direction.
And I think I joined a little bit late, but I didn't know this doctor name.
So this is our director of the clinic. This is Dr. Venkat.
Okay, yeah. Yeah, it's really nice to be here. And you can continue then. If I go any question, then I can.
Okay, thank you very much.
Thank you.
Right. Does anyone else have any other questions? Don't see any others. I think the presenters covered this topic very well indeed. So all that remains is for me to wrap up this evening's webinar. So as you know, we just alluded to in the discussion with Sabita, please do consider your relevant options. We're all, you know, the agency, Extraordinary Conceptions and Harley Street Fertility Clinic, we're here to help you get started. You can always have a first discussion, talk to us, and, you know, if we're not the right solution, we know who is, and we'll help guide you in the right direction. It's always my duty, I feel like a broken record sometimes. We still have a very present pandemic. Please continue to be safe, and consider getting vaccinated if you haven't already done so. Our next webinar is going to be on miscarriage and recurrent implantation failure, which should be quite an exciting topic. and that's on the 5th of November, again at 7:30 in the evening. You can find all our upcoming webinars at the webpage listed on this slide. And all that really remains is for me to thank our presenters. So thank you, Dr. Venkat. Thank you, Hilary, for your time this evening and your presentations. And I'd like to thank the audience for attending the talk. I hope it was useful and informative, and we'll see you in due course. Take care. Thank you very much.
Thank you, everyone.
Thank you.